Hi there, my name's Wendy Boyd Isaacson and I am a teacher in Sweden, and I would like to talk a little bit about what's been going on in the schools in Sweden since COVID came. What sort of protection have teachers had, and pupils of course, and what's it been like to actually teach. I'm from UK, so I have lots of relatives and friends in the UK that have been telling me what's been going on there. And I think it's important to get the message across of exactly what's been happening in Sweden too, because Sweden has decided to do differently to the rest of the world. We've decided to try and control COVID by having it run through society at a rate that doesn't overfill the hospitals. And what does actually that entail, and what consequences has it had? Well, I'm just really going to focus on schools. So everybody has a personal responsibility to try and prevent the spread of COVID. So the first thing that we've been told is we are to keep our distance from one another, and we're to stay home if we feel unwell. You are to test yourself if you have symptoms, but in order for that to work, you have to be older than 10 in most regions, and in some regions over than 13. So a lot of children are not getting tested at all. In most schools around Europe, you've been told to wear a mask, but that's never been recommended here in Sweden, except for a very short period on buses and trains during rush hour. But even there, from what I've heard of the people friends in Stockholm, less than half the people in rush hour on the trains have been wearing masks. And the other thing that we've had is vaccinate yourself, but that didn't arrive until for 12 plus until October, November. And then it's to reduce contacts, but that has now been removed. This is one's personal responsibility. And then I was trying to think, well, what responsibility have the schools had to try and reduce the spread so that pupils don't get sick, their pupils' families don't get sick, and of course their staff don't get sick. Well, the schools have to do a risk analysis that is supposed to reduce their infection level. After a breakout, in theory, the schools are supposed to change that risk analysis. Every time they have a breakout in one class or one teacher or one pupil, they're supposed to go in a feedback loop back to the risk analysis and change it. So let's say a child in my class got COVID and I was infected by that child in school, then we should realize that pupil to teacher transmission can occur, and therefore we should reduce that risk by putting in precautionary levels in school. That feedback loop of risk analysis has not happened in Sweden. The schools have not changed their risk analysis when infection has happened and occurred in the school. They're also supposed to report every infection risk. So let's say that this child infected me. There was also a risk maybe to 20 other children in the classroom that they could have caught COVID. They didn't have to actually catch it. They had to have a risk of catching it from the same child that passed it on to me. That's actually supposed to be reported. These risks are supposed to be reported to our health and safety agency. I actually rang and spoke to them, and I found out that way over 90% of schools are not actually reporting this risk at all. So what happens is you're supposed to report it and you're not doing it. The politicians are maybe very dependent on getting the right information so they can make decisions based on how much infection the schools are saying that they're having. And if schools aren't reporting this risk of infection, they actually have no idea of what's happening in schools. So this is what we're having as a major problem in Sweden. We are not actually improving our precautionary methods at all, because we're not learning from them, we're not changing our risk analysis, and we're not reporting back to the system what sort of level of risks we have. So that's sort of a little background of what's going on.